Hello everyone, I'm Dr. Akhil Tawari. I'm a fellowship trained adult and pediatric spine surgeon. Today I'll be talking about scoliosis. So, what exactly is scoliosis? When we look at the spine from the front, usually the spine should be straight, but for whatever reason, if there is curvature in the spine, which is more than 10 degrees, then that condition is called as scoliosis. Scoliosis is usually because of multiple reasons. It can be present from birth, that is congenital scoliosis. It can be secondary to infection, tumor, some syndrome. But most often than not, even we don't know why somebody suffers from scoliosis. And that particular type of scoliosis is called as idiopathic scoliosis. So, what are the symptoms and signs? So, whenever a patient is suffering from scoliosis, usually the parents or the school teachers, they get the patients to us with shoulders being unequal. They also present with a rib deformity or a hub. The patients also come to us if they notice some curvature in the spine or there is a waist asymmetry. And these are the symptoms or the signs, and as we can say, most likely because of cosmetic problems that the patients come to us. In minority patients, if the scoliosis is significant before the time it is picked up, the patients can present with neurological problems. That is, the child will have difficulty in walking, running, jumping compared to the peers. The child can have some breathing difficulties if it is significant scoliosis causing pressure on the lungs, or at the same time, if there is lot of scoliosis beyond 70 to 80 degrees, then it can also have an effect on the heart. So, how do we proceed if a child presents to us? Well, once the child comes to us with scoliosis, we first like to examine. So, we do a thorough physical exam. We like to measure the deformities by getting routine x-rays done. Now, these are special type of x-rays which have to be done in standing position. Once scoliosis is confirmed, we first like to measure the degree of scoliosis. Then we like to find what is the cause of scoliosis. So routinely, we get some advanced tests as well, which are called as MRI scans. And then once we are convinced what is the cause of scoliosis, the deformity, the gravity, as well as the age of the child, we sit with the patient's guardians, parents, teachers, and then we make a plan and go ahead. Now, the treatment of scoliosis depends, especially idiopathic scoliosis, depends upon the angle of curvature. So, if the angle is around 10 to 20 degrees, we usually like to observe the child, because scoliosis is a disease of growing bones. So whenever there is puberty and there is growth spurt, there is a high possibility that the scoliosis will progress. So we like to see the patients every 6 months and keep them under observation. If the angle is more than 20 degrees till 40 degrees, then there is very strong evidence of using specialized forms of brace, which are called as scoliosis brace. So we have a discussion with the child as well as the parents, and we encourage them to use a brace so that the disease doesn't progress. While there is strong evidence that bracing, when done appropriately and adequately, and by adequately I mean at least 16 hours per day, the progression can be stopped to a large extent. The efficiency of bracing is around 70 to 80%. Hence, it is essential that we are able to pick it early and we are able to encourage the child and make them compatible with bracing, because that is a powerful way of arresting progression of scoliosis. Suppose the child presents to us and if the angle is more than 45 to 50 degrees, then there is evidence that this is going to progress even once the child attains final height. In that scenario, most often than not, we have to rely on surgical intervention. The surgical intervention depends upon how much growth is remaining. It also depends upon how bad the scoliosis is, and it also depends upon, apart from the scoliosis or the bony problem, is there any spinal cord problem as well. So considering everything, we have a frank discussion with the parents, and either we do a growth sparing surgery, we do something called as vertebral body tethering techniques, definitive surgery called as a fusion surgery. Essentially, the treatment from surgery point of view for scoliosis is to attain a stable spine and to have a level shoulders and level pelvis, and making sure that that correction that we get is maintained throughout the life for the child.